So George, if I injure myself, how many treatments would I need till I'm fixed?
Yep, so everyone's a little bit different. Everybody heals at different stages, and depending what the injury is. A lot of people come in here and they've had back pain for a day, all right, or they've had back pain for 12 years. The problem is not necessarily the symptom they come in with, but how long that problem's been there. And sometimes you get a problem in your spine, and it's not until a couple of years that you start to give you troubles and pains and aches, and that's when you come and see me. But sometimes the problem has been there for 2 years, so it's going to take a while to correct that problem. So that's why in our initial consultation we do a thorough evaluation to see exactly what's going on. We normally take x-rays as well, because x-rays are a good view to see exactly what's going on with the spine, how much duration there is, how long the problem's actually been there, and gives a better indication how long it will take. In saying that, like, people think the younger you are, the faster you heal, and that is true to an extent, but I've had 80-year-olds that have surprised me and have healed as well as a 20-year-old. So it comes back to how much stress is on your spine and how long that stress has been there for.
And does it actually hurt to get treated?
No, the only time it might hurt a little bit is when you're acute, so you've got severe disc inflammation or something. So we're very conservative in our treatment there, because we know that the inflammation might be aggravated, so we're very gentle in our techniques. But generally, no pain at all. So, I mean, we adjust, from babies to 90-year-olds, and the technique changes according to the condition and the person in front of you as well. So.
Do you use any special techniques that other chiropractors may not use?
Yeah, so from my background with my headaches and migraines and my upper neck issues, I got pretty much interested in upper cervical chiropractic. And then I started studying with Joe Rhino down in Sydney, Atlas Orthogonal, which is a technique that specialises on the atlas itself, and we take specific x-rays to get a 3D image of how that atlas is sitting, and we can adjust it more precisely with an instrument at the right degrees. So I think there's only about 12 of us in Australia that do this technique. So both myself and Shannon here on the Central Coast, so we're pretty lucky to have 2 of us on the Central Coast that do this technique, and we have great results with this technique. It's something that just, the atlas is a very special joint where there's no discs in between the atlas and the axis, and there's a lot of issues that can arise from the atlas being misaligned. If you want more information, just look at our YouTube channel or our Facebook and our webpage as well.
How can that area of your neck be put out of place? So there's some examples of common injuries that could cause your neck to be put out of place.
Yeah, look, the most obvious thing is, of course, an accident or a fall. So a trauma to the spine would cause some misalignments in the spine. But then we don't think about things like posture, like repetitive strain. Like if you're at a computer desk all day, you're looking down all day, you're going to create tension in that top of that neck and make those muscles weak. That is most easy for them to come misaligned. So, posture is a big thing nowadays with our iPhones, with our laptops. Everyone's looking down, so we get a lot of tension at the top of the neck. So repetitive strain is what causes issues. So sometimes you might say, oh, but all I was doing, I got up in the morning, I made the bed and my back went. Well, it's things that have happened in the past that have led to that stage. So it could have been your sleeping posture, it could have been twisted, it could be your driving posture or your posture on the train, or it doesn't have to be necessarily bad posture, because if you have a good posture, but you're in that position for 45 minutes, your muscles contract, and then your posture becomes worse and worse and worse. So before you know it, your posture is not where it should be. So posture is a big thing. If you take care of your posture, you eliminate a lot of spinal issues. And of course, lifting and accidents, etc. as well. Another one that people don't think about is the stress element. So the emotional part that can cause stress on the spine, the muscles, etc. So an easy way to look at it is when you get stressed, normally people's shoulders get tensed up, and then that will lead to neck issues as well. So another option as well there. And then nutrition plays a role as well in spinal alignment. If you think about it, if you don't have the right nutrition, then the muscles and ligaments, these cells get replaced, and if their nutrition is not there for those muscles and ligaments, then you won't be able to hold or be as strong as you can be in your spine and your core strength. Okay, so when we adjust the spine, our aim is to improve the movement of that joint. Okay, so normally it's done traditionally by hand, where we guide the bone back into position. At our clinic, we also use an impulse IQ instrument, which is an instrument that gives impulses into the spine and it creates movement. The instrument actually has a sensor in the nose piece that detects the movement, and it won't stop until the field's move has been achieved.
So George, can you explain exactly what a manipulation is when you go to a chiropractor? How does it work and what are you trying to achieve?
Yep, so there's different techniques out there. The more traditional way is to adjust by hand. And when we do that, we guide the vertebra back into position. We also normally use a high velocity force with our hands, and you'll hear a cracking sound. That cracking sound is actually gas being released from the joint. It's not actually a bone on bone, which people normally think. All right, so that's a traditional way, but there's other techniques, and at our clinic what I use mostly is an impulse IQ, which is an instrument that gives impulse into the spine and it creates movement in that joint slowly. the instrument actually detects that movement and it won't stop until that movement's been achieved. I enjoy using the instrument because it's a lot more gentle on your spine. There's no cracking involved. We don't have to crack to get the joints to move. And also the vibration helps relax the ligaments around that area, and I find we get better results that way. As well, when we adjust the atlas, we use an instrument, which is just an impulse instrument again, and it's very gentle, very specific on that atlas, and it just gives a little jolt. There's actually a good video on our webpage, so if you click on the webpage and look for atlas orthogonal, you'll see the instrument and how we adjust.
So George, can you tell us how chiropractic can help someone who's either trying to fall pregnant or actually is pregnant, and then with the birth as well?
Yeah, when it comes to pregnancy, our main goal is to make sure that the pelvis and the birth canal is functioning as best it can. So biomechanically, when you're pregnant, you increase the pressure into your lower back and your pelvis, and you change the center of gravity. So that can have a bad effect on that SI joint and on the lumbar spine. So we've got to make sure that those joints are moving as freely as they can. The more free they're moving, the more easier and comfortable the pregnancy will be, and that will also help in your labour. And we've had a lot of patients that labour time has been reduced because of that, and even midwives have noticed that the birthing process itself happened a lot more easier. Everyone's a little bit different though, so it's best just to get checked and see if there's an issue and if we need to do something about it. Yeah, and the real thing that really, like after 12 years in practice, you can get a little bit bored because everything's kind of the same, but it's really the patients that you help, and not just so much that you get rid of the headaches or you get rid of the back pain, but the actual effect you have on their lives. So an example comes to mind where there was a lady who was getting headaches every single day, and then after a series of treatments, she managed to get rid of her headaches and she had no more headaches. So I asked her what's changed, and she said, no more headaches. But her daughter was next to her, and the daughter goes, well, Mum, actually, I've noticed that last few weeks you haven't been as angry as you used to be. And the mum goes, what do you mean? And she goes, well, before I used to come home from school and you were just screaming at us. And the mum goes, well, you know what? Because I don't have a headache anymore, I don't feel like I'm so stressed out, so I have to have better quality time with my children. So it's the effect you have on people's lives that really drives me to continue doing what I do, not just getting rid of the pains and symptoms.